Hi guys, so it's the Daspoort Block 1 group, and we're just going to briefly explain to you what we did, what you need to look out for, some quick tips that we thought would be useful for you guys. So yeah. So what we actually did, our main thing was to increase awareness of the dietetic practice because we felt that the community did not know exactly what we did and what the role of the dietitian was. And we also experienced a lot of resistance towards coming to see us. One patient, when we phoned, actually said to us, I don't have power, I don't have food, like, leave me alone. So we actually aim to increase the positive perception of our profession, and then also, increase the referrals and awareness of us. Every day we did daily nutrition education. We tried to vary our audiences, so we didn't always go for the patients. We found that the community health workers were very receptive to additional education. We did daily counseling. The nurses referred quite a few patients to us. We went into the reception area and asked if anyone would like to see us. Then every Tuesday and Wednesday we went to different clinics. So we went to the Zama Zama clinic on a Tuesday, and then the Woodlane clinic in Plastic View on a Wednesday, And then we also followed Marion to various creches to do growth monitoring for the little bits, which she will explain to you. We just try to immerse ourselves in as many activities as possible. So what we would like you to follow up on is especially the role of the dietitian in the multidisciplinary team. Because Daspoort is linked to the University of Victoria, just like you are a new group, there will be a new group of OTs, physios, medical doctors, and so forth. So the new students who are arriving do not know the role of a dietitian, even though we've had subjects together, they are very unaware. So you'll see every Thursday there's a case presentation from each various occupation. So you can use that to increase awareness. We place up posters on what exactly we do. And then something that's very important is to form relationships with the different teams, and that will further increase your referral. So we formed quite strong bonds with everyone, and then we would go and speak to them about a patient, and we'd be like, can you help? And then they would come and speak to us about a patient and ask us how we could help. So then also another thing to follow up on is Caden, who is a social work student. He has a multidisciplinary day in July. Confirm with him, but he definitely did want us to be part of it. So then another thing is the patient referrals. You need to start phoning for referrals and booking appointments ASAP, almost from day one. You'll see you have a box, and then there's the referrals in the box with their cell phone number and why they need to be referred. What we found very useful was to find out when they were next coming back to the clinic and then book the appointment for that day, because we found when we booked for a day that they were not coming to the clinic for any other reason, they actually did not show. So if they had to come to the clinic to get medication, book the appointment for that day, and it increases the chances that they will actually firstly pitch up, and then it decreases their transport costs. So just a few tips that we wish we had known. Inform the staff when you leave or you'll not be at the clinic, because often they would book appointments for like a Tuesday or Wednesday, and then we wouldn't be there, and then there would be like a little bit of chaos. So inform the staff when you won't be there. Maybe write it in the appointment book, and then they will know. Clients arrive when you least expect it, so try always to have someone at the clinic at all times. So we used to split up into 2 and 2, and then we would always have 2 people at the clinic. And then keep checking if the clients have arrived for the appointments. Go into reception, ask Jeanette, ask around, because often the patients sit there in the waiting room full of like 40 people and they actually get overlooked. Then the clients get agitated and they tell you that you've been keeping them waiting. So constantly check if your clients have actually arrived. And then plans don't always go as you would like them to. So you can't always stick to a strict time schedule. You can't always stick to your 1-hour appointment. Some people do require more or less time. So just be adaptable in that regard. So then another tip is to interact with everyone in the clinic. Build good relationships. You really do never know when you're going to need someone's help, when you're going to need them to participate in your intervention day, in your various interventions and nutrition educations. So build good relationships with them, participate in their things, participate in whatever they need you to, because they will reciprocate the favor. Don't just sit in your little office, go out, make friends, sit in the common area. Always be friendly, always be kind and receptive. We found that everyone that we were kind and friendly with really helped us on our day, from the cleaner to Corlia to everyone. They've really, really helped us out. So it's really good to build relationships. And then in terms of the nutrition education that you perform daily, you need to build relationships with the patients in the waiting room. They're a little bit resistant when you first go in and you want to teach them. They think that you're going to overwhelm them and all these things. So it's good to build relationships and explain to them that you're not forcing them into anything. The nutrition education we really found helped to attract patients and helped to raise awareness of what we did. So it really put us on the map, made us way more visible. And then specifically the handouts should be in English and Afrikaans. The majority of the Daspoort community is Afrikaans, so that element is actually very, very important. And then another really great audience that we found was the community health workers. If you train them in basic nutrition messages, it really, really helps because they go into the houses in the community and they can further educate. So that's it. Thanks, guys. I hope that you really enjoy your time at Daspoort. We really built special relationships and had an absolutely wonderful 6 weeks. It was a very, very, very unique experience. So yeah, just embrace everything.